Healthcare at the hospital, safety. Healthcare is in many ways closer to a service than a product. Much of safety in healthcare involves the treatment of patients, not the engineering of medical equipment, although engineered medical devices are playing an increasing role in healthcare. There are also special factors such as new hazards and diseases appearing all the time. Workplace safety and patient safety are more closely intertwined in healthcare than in other industries, although there are still significant differences. While it is normal for goals and hazards to conflict, healthcare is somewhat unique in that many of the hazards, thus constraints on how the goals can be achieved, conflict. That often makes finding acceptable solutions to safety problems more difficult. For example, consider the following two hazards. 1. Patients get a treatment that negatively impacts their health. 2. Patients do not get the treatment they need, which results in death or serious negative health impacts. There are times when taking extraordinary risks may be justified in this context, where either choice may involve serious losses. At the same time, much effort is spent in preventing unnecessary losses. Other unique factors in healthcare are that it is information intensive and human. Intensive, complex, imprecise, interdisciplinary, and constantly changing. Drucker says that healthcare institutions are complex, barely manageable places. Large healthcare institutions may be the most complex organizations in human history. An engineering approach to patient safety has never been emphasized. Patients are not engineered, and important biological and health information may be only partially known. But there are lots of engineered or designed components and processes in hospitals and healthcare, including electronic health records, medical devices, pharmacy procedures, and special procedures used to eliminate or control known hazards such as patient handoffs, communication protocols, checklists, and identification devices such as RFID, radio frequency identification. Procedures such as hand washing are used to control infections, while other interventions are used to reduce wrong site surgery, and so on. In recent years, there has been a tremendous increase in technology in healthcare. There are also management structures in most hospitals to manage quality and safety, as well as a large number of patient safety organizations devoted to promoting safety by designing healthcare systems to prevent adverse events, the common term for accidents or mishaps in healthcare. Safety and resilience in medical care and hospitals clearly depend on more than the behavior of frontline workers, including individual doctors, nurses, and technicians, which has often been the emphasis in healthcare safety. Design of processes, facilities, and equipment are all important, as well as training of personnel, the hospital culture, and management structures for safety and quality in hospitals. One limitation of the current approaches in healthcare and hospital safety is that they lack a holistic system standpoint, and the attempts to improve safety, while sincere, have been largely piecemeal and disjointed, like the proverbial blind men and the elephant. Each is focused on one part of the elephant, but misses the whole. Too much emphasis and responsibility have been placed on individual people, such as doctors and nurses, who have only limited control over the operations of the hospital and over the healthcare system as a whole. A more comprehensive approach could be achieved by using a mere holistic system approach.